So we are reading Water, You're Not Sick, You're Thirsty by Dr. Batman Gilich. We're on chapter 7, page number 60 of the PDF.
Chapter 7. The Primary Drought and Resource Management Programs. From the vantage point of the new medical science, the following conditions should be considered labels placed on the physiological processes in the body that denote a form of rationing and resource management when there is a limited supply of free water and other primary elements in the body.
So all these 7 are basically caused due to dehydration. So what he's saying, that medical science should claim that these are due to dehydration.
1. Asthma. 2. Allergies. 3. Hypertension or high blood pressure. 4. Type 2 diabetes. 5. Constipation. 6. Autoimmune diseases. If you don't drink water regularly every day of your life and don't understand the significance of pain, shortness of breath, and allergies as signs of dehydration, you will force your body into a disease state. Any of the above conditions will herald the beginnings of body decay produced by local or general water shortage and the associated chemical environmental changes.
So again, dehydration will cause changes in the environment in the body. When the environment changes, the cells have to respond by changing, right? Again, this is one of the main causes of cancer also.
Reversal of autoimmune conditions is not easy and not always possible. To reverse them requires an in-depth understanding of the importance of the acid-alkaline balance and the metabolic aspects associated with dehydration, such as the loss of a range of amino acids, insufficient absorption, or loss of vital minerals like zinc and magnesium, and the absolute need for essential vitamins and fatty acids.
So again, the acid-alkali balance of the body is extremely important. Okay. Now, the body needs to be at a pH level of 7.4. Due to metabolism, acid is the environment becomes acidic. So that's why consumption of alkaline food is very important. Drinking good water is extremely important. Breathing well, again, is extremely important. Otherwise, it will lead to all sorts of issues in the body system. And again, to maintain the balance, the body needs to absorb elements like calcium, magnesium, and zinc, right, to maintain the pH. So that again, that balance gets affected if the proper hydration is not there in the system.
Asthma and allergies. What is asthma? It is said people have asthma when they become short of breath, without any warning, to the point of nearly suffocating. Several thousand people die from suffocation due to asthma every year. Sometimes the onset of asthma is associated with repeated dry coughs with each breath. There is always an associated wheezing when exhaling, without an apparent infection in the lungs. Asthma affects more than 17 million Americans, mostly children. I believe that asthma and allergies are the body's crisis calls for water. They denote a state of dehydration in the human body. They herald continuing degeneration of the body until other complications of dehydration get established and can cause early death.
So again, asthma is one of the early indicators that there's something wrong with the hydration levels of the body system. If it is not taken care of, then other systems also start to fail.
Question: what has all this got to do with asthma?
Shubhamala,
Sorry. My experience and research tells me that the body possesses a number of highly sophisticated emergency thirst signals. We need to be aware of these newly identified indicators of water shortage in our body. All you may need to do cure some of your health problems is drink water instead of other fluids.
So many of the issues can just be taken care of if we start drinking adequate water. Now, of course, adequate water, what it is, he's going to tell us in the book, but there are other, I mean, we'll discuss it when it comes to that. What does he mean by adequate water?
Question: what has all this got to do with asthma? Answer: asthma and allergy conditions, mainly treated with different kinds of antihistamine medications, are important indicators of dehydration in the body. Histamine is an important neurotransmitter that primarily regulates the thirst mechanism for increased water intake. It also establishes a system of rationing for the available water in the drought-stricken body. Histamine is a most noble element employed in drought management of the body. It is not the villain that we have been led to believe due to our limitation of knowledge about the human body.
Okay, so histamine again, whenever there's a problem, people during research, they found histamine is there. So they started believing that histamine is the cause of all the issues that are taking place. And that's why antihistamine drugs got created. But histamine is actually the monitor of the water systems in the body. It is something that regulates it, right? So it is not the villain. It is actually a guy who's working for us, but we have started treating it as a villain.
In dehydration, histamine production and its activity increase greatly, and this generates the emergency thirst signals and indicators of the water rationing program that is taking place. Increased histamine release in the lungs causes spasms of the bronchioles, making them constrict. This natural spasmodic action of histamine on the bronchial tubes is part of the design of the body to conserve water that normally evaporates during breathing, the winter steam.
So again, when it's very cold weather and you breathe out, immediately water vapor forms, right? So this clearly indicates that in the process of breathing, we are losing a lot of water. So naturally, if there is dehydration in the system, the body wants to constrict or reduce the water loss. And one of the ways that they do it is through the regulating process that histamine monitors. So that's why the asthma attack comes. The bronchioles start closing up and it doesn't allow you to breathe because that is the way that we are losing water.
In dehydration, lung tissue becomes very vulnerable. The air sacs in the lungs have very thin walls and need water to keep them moist at all times. The constant flow of air through these sacs also evaporates the available water in their lining. Dehydration automatically reduces the amount of available water in these tissues and causes damage unless the rate of airflow is reduced.
So again, the histamine is wanting to reduce the damage to the lung. That is why the airflow starts getting constricted, right? Of course, it causes other issues in the body system, but it is just doing its job.
In essence, this is the rationale behind the blockage of airflow through the lungs in asthmatics. Histamine is responsible for cutting down the rate of airflow through the lungs. It causes constriction of the bronchioles that are attached to the air sacs. Histamine also stimulates the production of added amounts of thick and viscous mucus that partially plug the bronchioles and protect the lining of the bronchioles themselves. All these actions of histamine in dehydration are carried out to protect the delicate passageways of the body that are in direct contact with the outside air and could easily become dried up and parched if not protected. Histamine will be further discussed in the section on neurotransmitters in chapter 10.
So again, histamine is forming the mucus also, right? So again, when mucus is formed, histamine is there. They say the mucus is formed because of the histamine, but the histamine is forming the mucus to protect the lungs, right? But then we take antihistamine tablets to reduce the action of histamine.
Allergies and the immune system. When we become dehydrated, histamine sees to it that the available water in the body is well preserved and distributed according to a priority of function. The rate of histamine production in the body increases exponentially when the body becomes more and more dehydrated. Supplying the body with water causes a disappearance of histamine from areas where it should not be present. With adequate water supply, histamine production and its excess release is inhibited proportionately.
So basically, to take care of histamine, instead of taking antihistamine tablets, just drink more water.
This relationship of water to histamine has been demonstrated in several animal experiments. It is now physiologically apparent that water by itself has very strong natural antihistaminic properties.
So water is the best antihistamine.
Immune system suppression. There are certain white cells that are sensitive to histamine and that strongly inhibit the activity of the immune system in the bone marrow. There are twice as many of these white cells as there are cells that stimulate the immune system. Thus, dehydration that can cause the production and release of more than a certain amount of histamine may, in the long run, suppress the immune systems of the body at its central command station, the bone marrow.
So again, naturally, dehydration can cause an effect on the immune system. So that's why, again, hydration becomes very important.
Since there is a greater than normal rate of histamine production and storage in prolonged dehydration, a stimulus for the release of histamine from its immune system side of activity will produce a greater quantity of its release into the tissues. At the same time, antibody production and efficiency, which have already been suppressed because of dehydration, will be inadequate to deal with foreign agents such as pollen and other antigens. The enormity of this problem becomes apparent during the pollen season when the eyes get invaded with these foreign agents. The tear-producing glands need to wash the offending pollen away from the delicate membrane of the eye, the conjunctiva. Since antibodies are not adequately available to neutralize the pollen, this is the reason why histamine activity for secretion of water onto the delicate membranes covering the eyes and the nasal passages becomes exaggerated. It is a naturally installed need-driven response. Water wash is the only way of getting rid of the offending pollen types that are not neutralized by antibodies. This is how allergy to pollen occurs.
So again, allergies to pollen is a result of dehydration because of the action of histamine. But again, histamine is active because of dehydration, right? It's not the other way around. So again, hydration becomes very important to treat allergies. So that's why if you are having an allergic reaction to anything, drinking water becomes imperative.
If you were to ask me, do you mean to say I can prevent asthma and allergies by drinking more water? My answer would be yes, yes, and yes. Again, you can do it naturally with no medication at no cost. Water will do it because of the primary role of histamine in water regulation and drought management of the body. It is now clear that chronic dehydration is the primary cause of allergies and asthma in the human body. Increased water intake on a habit-forming regular basis should become the treatment of choice. In those who have attacks of asthma or allergic reactions to different pollens or foods, strict attention to adequate daily water intake with the addition of some salt should become a preventive measure. People who suffer from allergies and asthma will also have other indicators of dehydration. They will definitely develop other very serious health problems if they do not take their body's need for regular intake of water seriously.
So again, salt, right? When he's talking about salt here, it doesn't mean the refined salt. It means rock salt or sea salt, right? Because sea salt and rock salt have other minerals also dissolved in the salt. That's why it's much better to have rock salt or Himalayan salt or black salt than the regular manufactured salt.
If you have any doubts about this information, read Andrew Bowman's letter which follows. If you suffer from allergies and asthma, you must begin by drinking water on a regular basis. You should stop taking caffeine and alcohol until your conditions becomes normal.
So again, caffeine and alcohol create dehydration in the body system. So if you're not hydrated and you're having caffeine and alcohol, then it is going to compound the dehydration. It is not going to help it. So you need to stop taking caffeine and alcohol.
Those with normal heart and kidney functions should begin drinking 2 glasses of water a half hour before each meal and 1 glass of water 2.5 hours after the meal. When you increase your water intake, you also need to increase your salt intake to make up for the salt lost during increased urine production. Read more about salt in chapter 13.
So again, if the salts get lost from the body because of urine and increase of water intake, then it can cause other imbalances in the body system. That's why he's recommending to have salt when you increase your water intake.
Andrew Bowman suffered from different aspects of dehydration that emerged one after another until he was told nothing could be done for him. His doctor advised him to put his affairs in order before his anticipated early death. Fortunately for him, he discovered the medicinal effects of water and is still alive. He has reversed the variety of problems produced by dehydration, save one condition that is gradually improving. Mr. Bowman's case history highlights the serious implication of allergies during childhood, which can lead to the development of serious diseases later in life if steps are not taken to hydrate the body adequately. For more information on asthma and allergies and to read an abundance of testimonials from people who got rid of their problems, refer to my book, ABC of Asthma, Allergies and Lupus. November 13, 1998. Dear Dr. Batman Village, my name is Andrew J. Bowman and I am 42 years young, yet at age 34, I felt and looked like I was at least 44. Most of my life has been spent battling illness and disease, whereas now I celebrate each moment of each day with a renewed vigor and vitality. I used to be chronically dehydrated, and now I know better. I was born on October 29, 1956, in Taylor, Pennsylvania. My parents lovingly cared for me, including having me vaccinated. I was reared on infant formula and later cereal, juices, and a small amount of water when I would cry from colic. After my first polio vaccine, I became mysteriously paralyzed from the waist down. Specialists were puzzled yet diagnosed aborted polio. It left as suddenly as it appeared. When I received a booster dose of the vaccine at around age 5 in first grade, the paralysis returned. Months of hospitalization and bed rest resulted in my gaining weight. I mostly ate my meals and had visitors, drank soda and some water now and then. And once again, the paralyzation disappeared. When I began third grade, around 8 years old, my allergic afflictions and symptoms had begun. I had problems with frequent dry coughs. I began experiencing some difficulties with breathing, itchy and watery eyes, and fatigue when I was around fresh cut lawns from springtime until autumn. When I was a junior in high school, I experienced blackouts from allergies. Sometime around 1979, I saw a specialist who did testing and diagnosed me with allergies and asthma. I was treated with allergy shots and inhalers. The treatments just seemed to make things worse. My lips were always dry and cracked. At that time of my life, I was drinking about 2 to 4 cups of coffee per day, along with a few glasses of soda and some tea and alcohol. I would have an occasional glass of water during the day. The allergies and asthma stayed with me until 1996, when my water intake was up to about 2 to 3 quarts a day. I no longer struggle with allergies or asthma. My problem with diabetes began at age 14. I was diagnosed as an insulin dependent or juvenile diabetic. It was then that I began drinking diet beverages, including those with caffeine. My water intake at that time was still around 2 to 4 glasses a day, and I was drinking tea and started drinking coffee. The diabetes resulted in many hospitalizations over the years. By the mid 1980s, I had problems with diabetic neuropathy, which was causing my legs to swell. I was scheduled to have dye injected into my legs to perform a diagnostic scan after a Doppler radar study showed some apparent blockages in the veins in my legs. The dye injections caused my veins to burst, which made the swelling get worse. I was then diagnosed with venous insufficiency. In 1994, I was told that my legs would probably have to be removed within a year or so.
So in diabetes, the legs start to swell up.
While attempting to get on a diabetic insulin supply trial, the initial examination revealed that the retinas in my eyes had grown blood vessels that were bleeding, diabetic retinopathy. I began receiving a series of laser surgeries over the next 15 years to attempt to seal the leaky vessels and to attempt to prevent any new vessel growth. This reduced my peripheral and night vision. In 1992, I developed an enlarged yet benign prostate gland, and my kidneys began showing signs of deterioration. In 1993, I began experiencing some potency difficulties. In 1994, I began seeing a natural or homeopathic physician who, besides treating me with alternative medicine, advised me to increase my water intake. My intake of insulin was around 95 units of insulin daily. In 1976, many immune system problems began developing. I developed infectious mononucleosis. In 1979, during one of my then frequent hospital stays, I was diagnosed with mono again. The doctors insisted that I shouldn't have mono again and began consulting with specialists. I received an influenza vaccine and was discharged, only to be readmitted a day later with a fever of 106 degrees Fahrenheit. I was undergoing many tests, however, nothing much was showing up at that time. After many tests for severe abdominal pain, I was told that I grew a second spleen that was attached to my spleen and that the second one was also functioning. That year, I was visiting someone and drank unpasteurized milk, and ended up in the hospital again with a bacterial infection of the intestinal tract. Brucellosis and Proteus OX19 was the diagnosis, and I was on yet more antibiotics. During 1980 or 81, I developed another case of mono and was admitted to the hospital again. Diabetic control problems were a constant battle for me. An infectious disease specialist discovered that a number of special antibodies against foreign agents were also affected, which the doctor suggested were related to the problems with my allergies and asthma, as well as my frequent infections. The 1980s were filled with many hospitalizations, illnesses, job losses, and stress related problems. It was then that I was diagnosed with allergies to penicillin and tetracycline, began developing hypertension, was diagnosed with chronic fatigue syndrome, lymphoid hyperplasia, overstressed immune system, arthritis, bursitis, fibromyalgia, acid reflux problems, and bowel problems.
So literally you name it and he had it, right?
I also developed a benign tumor on the left flank of my back. I developed a nodule on my thyroid area and was diagnosed with lead, cadmium, and aluminium poisoning, which were also found in a landfill I lived near. I was overweight and developed sleep apnea.
So again, these metals, right? The metals can become poisonous. It can lead to Alzheimer's also. I think he's going to talk about it later in the book.
Tests show that I stopped breathing over 300 times in a 6-hour period and had narcolepsy. I could fall asleep in a short period of time. I had surgery to attempt to correct the sleep apnea, and I wore a tracheostomy tube in my neck to help me breathe at night and slept with a breathing machine to keep my airway open. During the 80s, I still only drank a few glasses of water daily, yet consumed large amounts of coffee, saccharine, and eventually NutraSweet. In 1987, I was declared disabled. In 1992, at 36 years old, I looked and felt like I was in my late 40s and felt worse than I looked. I began using natural supplements with vitamins, herbs, and other natural medical techniques. The natural doctor's advice was to increase my water consumption and decrease my caffeine intake as well. I had lost the feeling in my feet, was always tired and achy, depressed, and had little hope. I began to drink more water and reduced my caffeine intake somewhat, and by 1995 I began to feel and look much better. Yet I was still only consuming a quart to a quart and a half daily and not flushing all the caffeine out of my system, nor was I using sea salt. In September of 1995, the lump on my left flank turned red, began itching and enlarging. My family physician removed it and sent it away for study. In October, I was diagnosed with cutaneous B cell lymphoma. 26 new tumors had grown on my back where there was one, and I was sent to a major hospital where I was told that lymphatic cancer on the skin surface was rare and that not much research was done yet on it. I went for a gallium scan, and it revealed that my entire body surface glowed positive for cancer cells. The flank of my back was brighter white or hyperpositive, as was the middle of my chest, where 2 melanomas were previously removed. I was advised to receive localized radiation, and as tumors appeared, we would radiate them too. Or I could travel to Philadelphia and have my entire body surface radiated. They began to radiate my back, which began giving me third-degree burns. I refused total body radiation, and midway through my radiation, my homeopathic physician began using a natural cleansing therapy. The cancer specialist had advised me to try anything and to pull out all the stops as well as to get my affairs in order. I increased my water consumption and took supplements and natural treatments.
So again, supplements and natural treatments, along with increasing water.
In November of 1995, while traveling in search of an answer, I was introduced to a man who exposed me to your water cure program and advised me to stick to it very seriously to get cured. I now began to seriously increase my water intake, but was still leery of increasing salt intake due to the traditional medical contraindications for its perceived high blood pressure problems. Later, I learned of the error of that thinking and began to increase my salt intake too. In March of 1996, I went for another gallium scan, which revealed that there was not a single sign of cancer glowing positive on my entire body. Doctors thought there was an error in the gallium scan, but my homeopath and I knew that I was healing. Drinking more water, reducing caffeine, a change in dietary habits, natural medicine, and faith had brought me home. Since then, I have been constantly improving in my health. I no longer have two spleens, but one that is normal in size and function. Now I lick sea salt off my palm in the morning before my first glass of water and use salt liberally. I drink about 1.5 gallons of water a day and take supplements as well as eating a whole lot of grains and fresh fruits and vegetables. My waist used to be a size 43 and now is a size 36. I weighed 249 pounds, now I weigh 210 and have solid muscle mass. My complexion and appearance are those of a man in his early 30s and my potency of a man in his 20s. My ankles are no longer swollen and new pulses, yes, new pulses have developed where once they were dead. I no longer take any medications for all those problems, whereas I used to be on at least 15 prescriptions at a time. My insulin needs are down from 95 units a day to 35 to 45 units a day. I no longer suffer with chronic infections or fatigue. I sleep 6 to 8 hours a day instead of 12 to 14. It is rare for me to take an antibiotic, whereas I seem to be constantly taking them before I don't have allergies or asthma or gastroparesis, acid reflux anymore. I no longer suffer from arthritis, bursitis, or bowel problems. At the time of my last stress test, my doctor, who is younger than I am, told me that I was in better shape than he was. The high blood pressure is constantly improving. No more thyroid nodule. I sleep better and no more heavy metal toxicity. I have a new lease on life. My prayers have been answered. God led me to a natural way to heal my body, my mind, and my spirit. I am living a new life now with a balance of water, salt, minerals, supplements, good nutrition, and continued improvements in my quality of life. I am truly blessed. Sincerely, Andrew J. Bowman.
So again, just by increasing water, you can see how many things he actually took care of.
Michael P. is in his 50s. He suffered from allergies and eventually asthma since childhood. Later in life, he became overweight and developed high blood pressure. His allergies were so bad that he had to pay attention to the daily pollen count before he could step out of the house. Several years ago, he became aware of the curative properties of water in asthma and allergy. He started regulating his daily water intake and stopped drinking tea and coffee. When everyone in the office took coffee, he would drink hot water. Since then, Michael has not had any asthma attacks His allergy has become much less troublesome, almost to the point of being non-existent. He no longer bothers with the pollen count. He has been free of allergy and asthma attacks since he started regulating his daily water intake. He considers himself cured of his health problems, including hypertension. Question: why is my doctor not aware of the information on water and asthma? Answer: what I have shared with you so far is new knowledge. It has taken me more than 20 years of research and study to highlight this information. It is not yet common knowledge and it is not yet taught at medical schools. Doctors recommend fluid intake and assume that any fluid you take will act like water. This is what doctors have been taught at medical school. They are not well informed about the intricate functions of water in the human body and do not yet understand chronic dehydration. They do not realize that not all fluids are suited to the normal physiological functions of the human body.
So nothing, no other fluid can substitute for water.
Furthermore, fluids that contain caffeine and alcohol dehydrate us and cannot replace the water needs of the human body. Caffeine and alcohol force the kidneys to flush some of the water reserves of the body.
So again, caffeine and alcohol actually need more water to be metabolized in so that they can be flushed out of the system. So they actually use more water. We may think that because they are liquids, that they are providing the hydration that we need, they actually create dehydration in the system.
Nathaniel C. is a young man in his 20s. He suffered from asthma since childhood. On several occasions, he developed attacks that needed immediate attention at the emergency department of the nearest hospital. One of these attacks was so severe that he needed to be hospitalized. Consequently, in constant fear of a repeat of these attacks, his inhaler was always with him and used frequently, possibly more often than prescribed. A good morning to him would mean a few puffs from his inhaler. He could not endure smoky rooms. He could not go through a business meeting without the support of his inhaler, nor could he exercise with the same abandon and pleasure as his friends. For Nathaniel, fear and the constant threat of another attack preoccupied his mind and punctuated the day's activity. When he became aware of the topic of my research, chronic dehydration, he wanted to know if his asthma could be helped with water. He was surprised when I informed him that asthma was caused mainly by chronic dehydration. After adjusting his daily water intake and reducing his coffee intake, his breathing became more comfortable. He could no longer He could go longer hours without needing his puffs of medication. He was able to reduce and eventually do away with his inhaler. He has been virtually free of his asthma and its associated fears for the past few years. JR, a physician, had developed adult onset allergies and asthma when he was in college. At times, he would get such severe attacks that he would need hospitalization for his suffocation and shocked state. He was allergic to cats more severely than any other things. He would never step into a house where there was a cat. Before accepting an invitation, he would ask if they kept a cat. Such was the state of his body sensitivity to some allergens.
So people can be allergic and sensitive to literally anything.
One day, while he was talking to me on the telephone, I noticed his repeated dry and gasping coughs. This was how I learned about his asthma. I asked him to drink a glass of water and put a pinch of salt on his tongue. His words, as you recall, I was having a coughing spell that interrupted my work, and as you directed, the putting of some granules of salt on my tongue not only calmed my coughing but took it away. My nurses commented on my not coughing some 5 minutes later. For the past 7 years, he has been free of asthma and allergies. He seems not to fear cats anymore. He visits friends who have cats in their homes. He now treats his asthmatic patients with water and some added salt intake.
So again, salt, right? So this is a cure. We can try it. If you're coughing, just put a little salt on your tongue and see what happens.
Asthma, in my opinion, is not a disease. It is a crisis complication of water shortage in the body. Anytime asthmatics do not drink enough water, their predisposition to asthma attacks will come back. You cannot be lazy about drinking water and expect asthma to stay away. Many people who get well and think the problem is over get a rude shock when shortness of breath begins again once they slack off from the routine. We now know the cause of asthma, dehydration. If we can get this simple understanding of asthma into the minds of the American public, I believe we can easily eradicate asthma from the list of health concerns in this country and the rest of the world in less than 5 years.
I wish I had known all this because my grandmother was severely asthmatic, right? And one thing I've seen, if someone is coughing or anything, just increase water. You're having fever, increase water intake. It works like magic, let me tell you. This is something that all of us have to really try to be able to understand that yes, it really works.
Let me share with you a story that happened recently. I was discussing the various complications of dehydration during an interview on a popular local radio show. A lady called to thank a friend of mine for having disseminated information about asthma and dehydration in that part of the world. The listener then told me she has two small children in her family, 3 and 4 years old. 2 winters ago, both youngsters suffered from severe asthma, which caused their family great concern. At the beginning of last year, she increased their water intake. The result? These children no longer suffer from asthma, not even one episode the whole of last winter. She also told us how her husband's insulin dependent diabetes has started improving since he has increased his water intake. He now needs much less insulin to manage his daily life. Her daughter also suffered from severe back pain and was diagnosed with lumbar disc degeneration and atrophy. She too went on the water cure and is now pain free. From one person in this family taking the information on chronic dehydration seriously and acting on the water cure recommendations, 4 of her family members are no longer in serious danger from the complications of dehydration. An important aspect of their discovery about water is their freedom from medical ignorance that would have treated their health problems with chemical products or invasive procedures that would have drastically compromised their health and financial resources. Increased food intake, when not accompanied by increased water intake, will also produce susceptibility to allergies.
So again, what food needs water to be digested. So if you're eating and not drinking enough water, again, it will cause issues.
Increased food intake, when not accompanied by increased water intake, will also produce susceptibility to allergies. If you remember, food-laden concentrated blood has to circulate through the lungs and further give up some of its water through evaporation. People with allergies and asthma should make it a habit to drink water before eating their food. at least a few minutes before beginning. At no time should they allow food intake to concentrate their body fluids to the extent that high levels of histamine generation become a permanent situation.
So again, if dehydration becomes permanent, then that histamine generation becomes a permanent thing in the body. And then again, it becomes a vicious cycle.
Question: what is wrong with waiting until you feel thirsty to drink water? Answer: the body is already thirsty before we feel the thirst sensation. Dry mouth is not an accurate sign of water shortage in our body. There is a mechanism by which, even when we are comparatively dehydrated, saliva production is not affected. The reason is that we must be able to lubricate food during the process of chewing and swallowing. The misconception about dry mouth as an accurate indicator of body water shortage has steered the trends in medical research, of course, so that even today it is not generally known at what stage the body is thirsty and becoming pathologically dehydrated. It is not fully appreciated what devastating damage is caused by a slowly establishing dehydration in the body. If children are not able to regulate their water intake properly, histamine activity in the lungs may become a dominant trend. One of the consequences of overactivity of histamine in the lungs may be the occurrence of an inflammatory process at a time when the development of lung tissue has to keep up with the physical growth of the body. Excessive fibrous tissue formation and the creation of cysts where alveoli have to be formed may be the consequence of dehydration in children who are growing. It seems that cystic fibrosis of the lungs may not be an entirely genetic disorder, but may have dehydration as a common basic problem to both the DNA assembly system and lung tissue formation. Dehydration is also responsible for the production of excess thick mucus in the bronchioles, a problem in cystic fibrosis of the lungs. Water and salt should help loosen the mucus. Children need water for cell growth. During growth, 75% of the cell volume has to be filled with water. This is the reason why children develop asthma and allergies during their growing phase of their physical development.
So again, water gets sucked out, putting into the cell, right? So now less water is available. It wants to restrict. The body wants to restrict the water. So that's why asthma develops. Salt helps in loosening the mucus. That's very important. That's why having salt in a regulated manner is very good for the system, but the body must know that the salt is there. So the best way is before you drink water, just put a little bit of salt on the tip of your tongue and then drink the water. The water intake will become better.
As we grow older, we lose our thirst sensation and do not recognize that our body is thirsty. Chronic dehydration in the elderly can cause heart and kidney damage, coupled with shortness of breath. At this stage, the shortness of breath is called cardiac asthma. Those with heart problems and kidney disease should increase their water intake slowly and, if possible, under the supervision of their physicians.
So again, just add, just increasing water intake in one shot is not a good idea. There has to be gradual increase in water intake when you have kidney and liver problems and heart problems, right? Slow and steady, keep increasing the water intake so that the body can adjust to the increased water supply. And of course, the physician, if they hear, it's very good. But 99% of the physicians don't know about what we are talking.
They need to make sure their urine production increases with the additional water.
So now this is again important, right? So if you are having additional water, if you measure the urine output, it should increase proportionately to the increased water intake. Only unless, you're living in a very, very hot climate and you're sweating a lot. So that's another way that we are detoxifying or releasing the water from our system. So measuring urine can become a very nice tool.
If within 2 full days there is no indication of more urine being produced, a physician should be consulted. The color of urine in a dehydrated person not taking vitamins that could color the urine will be dark yellow to orange. In a better hydrated person, the urine is lighter in color.
So by just watching the color of your urine also, you can figure out whether you're hydrated or dehydrated.
Children and adults who get asthma attacks with exercise and strenuous effort should always remember to drink water before they begin exercising and to stop drinking caffeine-containing sodas. They should reduce their orange juice intake, if more than 2 glasses, because of its high potassium content. Too much orange juice can predispose a person to asthma attacks. The water,
Yeah. So
the
again,
water,
orange juice also, you have to, anything in excess is a problem. That balancing is very, very important.
the water needs to of the body cannot be fully replaced by juices or even milk.
So again, you have to drink water because juice and milk is actually considered food.
On no account should you abruptly cut off the use of your medications. You should begin by taking more water with your medications until your need for medication decreases. Keep the doctor in charge of your treatment informed. You will then be able to work with your doctor to gradually reduce the use of the normally prescribed inhalant or antihistamine medications until you no longer need them.
So again, never get off medication immediately, right? It needs to be regulated properly.
In obstinate and truly drug-dependent cases of asthma and allergies, increased water intake will improve the patient's response to the medications being prescribed until the body gets back to its normal rhythm. The choice of water should not become a limiting factor to drinking it. So long as tap water contains no lead, mercury, pesticides, insecticides, or other dangerous chemicals or bacteria, it should become your fluid of choice. It is available to you everywhere you go.
So again, now bottled water, most bottled water is actually acidic. Okay, if you see the labeling in the water, there are only two brands in India which label the pH of the water. That's Himalaya. Previously, they were labeling at 7.4. Now they've come down to 7.2. And there's another Bisleri brand which is called Vedika. These two brands have alkaline water because the pH is above 7, right? Most other normal mineral water that they call, it's actually not mineral water. It is actually RO water which has been bottled. And RO water has a acidic tendency. So most bottled water is actually acidic, which can be bad for you. So when he's talking about fluid of your choice here, tap water is actually better. If it is filtered tap water, it's actually better than bottled water in my view.
You should not worry about its hardness. Any calcium that is dissolved in water may even serve a useful purpose, as it might help your body's need for calcium. If the smell of chlorine is too much, fill an open-top jug and leave it exposed to air. The chlorine will evaporate in less than a half hour, and the water will be sweet and ready to drink.
So again, filtered water that is supplied by the corporations is generally treated with chlorine, right? So one of the ways, if the smell of chlorine is there, fortunately in Calcutta at least we don't have it. I think tap water in Calcutta is better than most bottled water. But again, people don't realize it, right? And also over here, he says very clearly that if it is hard water, it is not a problem. Okay. Yeah. Now, iron content in the water, that's a different ballgame altogether. But hardness can also be due to calcium, and calcium in the water is not a problem. Having said that, many of the cities have now started lacing water with fluoride. I think he's going to talk about that also. That can become a issue and a problem. Okay, so fluoride can become a problem.
It is becoming fashionable to advocate drinking distilled water. This claim may prove to be based on the commercial aims of its manufacturers. I have found no reason to drink distilled water over regular tap water that does not contain toxic substances. If you are unsure of your local water, it would be a good idea to install a solid carbon filter on your kitchen faucet.
So carbon generally absorbs impurities and the water can be filtered, right? Distilled water drinking is like poison, let me tell you, because water, it has no mineral content. Whatever it touches, it will absorb the mineral from that. So it can actually lead to minerals being sucked out of your body rather than putting minerals into your body.
With increased water intake, which will cause increased urine production, there may be an associated loss of salt as well as other minerals and water-soluble vitamins. Supplementing your daily vitamin intake is necessary. If you develop cramps, you should assume that the salt in your diet is not sufficient for your body's needs.
So again, when you cramps mostly are caused by dehydration and a lack of salt in the system.
You should add salt to your diet as long as you stick to taking more water. In asthma and allergy sufferers, salt intake becomes a vital part of the treatment.
So again, people with asthma should actually note this, right? Salt intake is very important.
Salt unplugs the thick mucus secretions in the lungs and stops the overflow of nasal secretion when water is plentiful. Salt breaks up mucus, rendering it watery and stringy and suitable for expulsion with the flow of sputum when water is also available. I recommend to asthmatics who are about to get an attack or are in the middle of an asthma attack to drink 2 to 3 glasses of water and then put a pinch of salt on their tongue. Water and salt will tell the brain that the missing components in a dehydrated body, in asthmatics in particular, have entered the system. The brain will immediately instruct the bronchioles to relax and breathing will become much easier. When the salt reaches the lungs, salt pumps secrete it in the bronchioles to loosen the mucus plugs and prepare them to be carried away. Only when water is available.
So just having salt without water intake, again, is not a good idea.
Too much salt and not enough water may do the opposite. It might cause constriction of the bronchioles. This is why phlegm always tastes salty. Salt is essential to keep the airways of the body clear, including the nasal passageways when you have a cold. Salt also unplugs mucus in the nose and the sinuses and stops runny nose in allergic reactions.
So again, salt again, along with water is very important. We can stop here today.